So thank you everyone for coming. So our presentation is Shot for Thought, which deals with how fear has manipulated the response towards vaccines. This is as part of our honors class, as it shows at the bottom. And so I'm Paula Hernandez.
Marisa Benavides.
I'm Jennifer Mikhail.
I'm Ronnie Mishra.
And I'm Carolyn Todd.
And this is our presentation. So researchers have been studying and working with mRNA vaccines for decades. Interest has recently grown in these vaccines because they can be developed in laboratories using readily available materials. And with little time to waste to bring the COVID-19 pandemic under control, it was a great resource. Now, not every vaccine is granted emergency use authorization. However, COVID-19 proved a rapidly spreading and dangerous disease. So the FDA worked with the vaccine manufacturers and independent laboratories, academic research centers, and nonprofit organizations to quickly gather and interpret large amounts of data on the vaccines in order to approve them. After many months of studies and more than 165 million people having received a COVID-19 vaccine, the data showed that the vaccines were very effective in preventing severe COVID-19, and the risk of serious side effects were extremely low.
Millions of people in the US have taken the vaccine to be protected by COVID-19 after they were approved by the Food and Drug Administration. The available vaccines are undergoing constant safety monitoring, and evidence collected from research trials prove that the COVID-19 vaccine is safe for administration. The vaccines were formed using trusted scientific methods that have been used for decades. While side effects might occur, they are temporary and will not affect long-term health. The benefits of the COVID-19 vaccination outweigh the known and potential risks. The vaccine reduces the risk of getting and spreading COVID-19 among your community. While vaccinated people can still get COVID-19, the vaccine prevents them from getting extremely ill due to the virus's effect on the body. In terms of the Delta variant, vaccines continue to reduce a person's risk of contracting the virus that causes COVID-19, including this variant. Vaccines continue to be highly effective at preventing hospitalization and death, and fully vaccinated people with breakthrough infections from this variant appear to be infectious for a shorter period of time. Once fully vaccinated, people can safely go back to their normal lives. They can attend public events or meet with family members without having to worry about spreading COVID-19. The vaccine builds protection through herd immunity. Herd immunity occurs when a community or the herd becomes immune to a disease. Jennifer, could you mute yourself? Okay. Making the spread of a disease from person to person unlikely. As a result, the whole community becomes protected, not just those who are immune. Often, a percentage of the population must be capable of getting a disease in order for it to spread. This is called a threshold proportion. If the proportion of the population that is immune to the disease is greater than the threshold, the spread of the disease will decline. This is known as the herd immunity threshold.
So another benefit of the COVID-19 vaccine is the booster shot. So vaccine effectiveness decreases over time. So the booster shots help prevent this and increases the protection and immune response to the COVID-19 and the different variants, such as the Delta variant. The booster shot helps with preventing COVID-19 with symptoms. And then it also increases immune response because people have higher protection against COVID-19.
Did we skip a slide?
No, I don't think so.
Okay, okay, sorry. There are different types of vaccines to fight COVID-19. Moderna and Pfizer use mRNA technology, while others, such as Johnson & Johnson, use a more traditional route, which is a disabled adenovirus to deliver the instructions on how to get rid of unwanted cells that come from COVID-19. It is not related to COVID-19 virus, and it cannot replicate in your body, so it will not give you the infection, just a instructed way to get rid of those cells. Then, okay. A lot of people are afraid of vaccines because they do not understand the science behind how these vaccines are made. The COVID-19 COVID-19 vaccine, Pfizer and Moderna, are mRNA vaccines. And instead of using a weakened or inactivated germ, they are created in a laboratory and teach our cells to make a protein that help give instructions on how to disarm and get rid of the COVID-19 cells that contain that protein. It is given in the upper arm, and then from there is given a piece of a protein. It's called spike protein, which then they learn to fight that specific type of protein when it shows up in the certain cells. Because of social media, getting information is easy, but is also easy to get too much of the wrong information. These are the most common myths about COVID-19 vaccines and their debunking facts. These are sources that come from the CDC, Johns Hopkins, and the Mayo Clinic. The first myth is that vaccines can affect women's fertility. And the truth is the vaccine just encourages our body's cells to make a protein and teaches our immune system to fight it. It has no way of affecting fertility. Another myth is that if I have already had COVID-19, then I don't need the vaccine. And research has proven constantly that the best protection against COVID-19 is still the vaccine, regardless if you have had it or not, because there is no way to know for sure if you developed the proper antibodies to fight it. Another myth that tends to scare people is that they think by getting the vaccine, they are injecting COVID-19, and that is not true. The vaccine just delivers instructions on how to fight the protein. You do not develop COVID-19. And the last myth is one that is really popular about spreading, and that is the side effects you get are dangerous. And while it is true you can develop side effects, most of them are like headaches, fever, and sore muscles. They rarely last for more than 2 days, is what a majority of people reported. And the risk of serious side effects are very rare, and they outweigh the danger of ending up in the ICU and potentially dying.
There have been many rumors going around about the COVID vaccination. Like we mentioned before, these rumors are myths are not true. They tend to cause a rise in fear, which manipulates our actions. As you will see, the fears for vaccinations have dated back since vaccinations were created. This has been repeated through history. Let's dive in and see if these fears were legitimate or fabrication. As long as vaccinations have been around, individuals have been fearful of them. In 1720, the vaccination against smallpox was called an antithetical to God's will. Then a bomb was thrown into the house of a pro-vaccination minister. The birth of the first anti-vaccine movement was with the first vaccine. Claims that vaccinations cause autism, multiple sclerosis, and diabetes has dated back to the 1700s. Although the time periods have changed, the emotions and deep-rooted beliefs, whether philosophical, political, or spiritual, that underlie vaccine opposition have remained relatively consistent since Edward Jenner introduced vaccinations. Wellness influencers, along with other famous individuals, are asking their fans and followers to question vaccinations. According to the Washington Post, one wellness influencer, Jessica Hesser, asked her followers on Instagram to question the integrity of the coronavirus vaccination. Jenny McCarthy, an actress, has several books stating that there is a link between autism and vaccinating children. These accusations place a misunderstanding and being uneducated on the matter.
Here we can see some examples of those with influence or positions of power spreading fear regarding the COVID-19 vaccine. And on the left, rapper Nicki Minaj shares a medically lucrative tale of her cousin having testicular issues following vaccination, appealing to the fear of the unknown side effects that come with any medical advancement. On the right, we see Senator Ted Cruz appealing to right-wing fears of government overreach to discredit getting vaccinated as an act done for the public good.
So highly polarized anti-vaccine media comments or conversations are high in number in the media. This is known as the infodemic since it takes place on social media such as Twitter or Instagram or Facebook. And this infodemic are caused by individuals with no medical background, creating conversations that stem from misinformation or stuff they got from other social media accounts. And this is where the social media infodemic stems from. Over 85,000 new anti-vaccine accounts on Facebook have led to roughly around 60 million anti-COVID vaccine followers. And healthcare workers do not want to or are hesitant to correct the misinformation that is being spread around social media because there's so high amounts of misinformation that are like covered up. And then this decreases the promotion of pro-vaccination social media comments, information posts, or conversations. And there's so many anti-vaccination accounts on social media because they have high reliance of fellow accounts that promote similar views to theirs on vaccines.
In the early 1950s, before polio vaccines were available, polio outbreaks caused more than 15,000 cases of paralysis each year. Following the introduction of vaccines, the number of polio cases fell rapidly to less than 100 in the 1960s and fewer than 10 in the 1970s. Thanks to the polio vaccine, dedicated healthcare professionals, and parents who vaccinate their children on schedule, polio has been eliminated in this country for more than 30 years, which means there's no year transmission of the polio virus in the United States. With the most recent mutation of the COVID-19 virus, Omicron, it is important to get vaccinated in order to get to a point where the transmissions are as low as the polio virus.
We hope you have distinguished the truth about the vaccine from our presentation today. As you can see, many variants populate over the world which can threaten our health. We urge you to protect yourself and your community by taking the vaccine. While the US has been able to provide sufficient vaccines for its population, other countries cannot say the same. Many third world countries will not be able to get the vaccine for a few years. In some cases, it might take them until 2025 to get their entire population vaccinated. We hope you are as passionate about vaccine accessibility as we are. Please sign this petition by scanning the QR code. This petition urges the vaccine manufacturers to produce and deliver doses for such countries that do not have easy access to them. Thank you for joining us and have a great rest of your day.